Greetings all, welcome back. Steve Zilke here. This video is going to focus on statistics of dental professionals, but more specifically hygienists as it relates to wrist and forearm pain. That's what this is about. So this will be the first of a 3 to 4 part video series where today I'm going over statistics, 5 minutes I'm expecting, at least on the trial runs I didn't like very much. I think this is my 7th journey through this, where I'm going to go through this and talk about statistics. The next two, I'm going to talk about, or review, I should say, 2 articles I found online and giving you their recommendations. And I'm going to comment on those and tell you what I like and what I don't like, why you should do this or why you should not do that. The 4th video then, so I guess it will be 4. The 4th video then, I'm going to give you a complete program, beginning to end, of what I recommend based upon my 35 years of doing this to cut to the chase and to finally get rid of this pain in you guys once and for all. I have some pretty solid ideas. It's a program that's going to work if you do it. So hang out for that. So tell your friends, share this with other people, because I'm really here to help you guys. Really, that's why I'm doing this, to help you guys, right? So let's get to the abstract right here and we'll talk through it. Scroll this down. There we go. So we have here is, so we have in PubMed, and it was published in 2009, as you can see. Title, A Systemic Review of Musculoskeletal Disorders Among Dental Professionals. The authors were Hayes, Cockrell, and Smith. So let's get to the body of the text here. It says, musculoskeletal problems have become a significant issue for the profession of dentistry and dental hygiene. This review provides a detailed examination and discussion regarding the prevalence of musculoskeletal disorders, as I say MSD, in dental personnel, and possible causative factors. All research studies and literature reviews which have been reported on the prevalence of musculoskeletal symptoms and or potential risk factors for this problem in dentists, hygienists, and students were selected in our inclusion. So just to be clear, this is not an independent, standalone primary study. This is a compilation of data that they did from other studies, pull it all together to get stats. That's what we got. So let's get to the nuts and bolts then. Our literature suggests that the prevalence of general musculoskeletal pain ranges between 64 and 93%. That's all the way up there. So 2/3 of you have some form of musculoskeletal pain all the time, somewhere. Right? That's the range. You start at 64%, possibly don't. The most prevalent factors for pain in dentists have been shown to be the back, 36 to 60% range, and the neck, about 20 to 85% range. That's a pretty big range. There must have been some different demographics in these studies. While the wrist and hand regions were the most prevalent regions for dental hygienists, 60 to 70%. And we can just stop there. So, dental hygienists. The studies pulled together show that you guys deal with hand, wrist, and forearm pain, that region, on a scale of 60 to 70% of you will be dealing with that on a somewhat regular basis. It's like headaches, right? Sometimes we get them, sometimes we don't. I'm sure on a lighter day, it doesn't hurt bad. A long 12-hour day, it hurts more. I got you. That's normal. Well, not normal, but you know what I mean. So 60 to 70% of you are dealing with this issue all the time. That's not okay with me. And it sure as heck should not be okay with you as an individual or your team or your profession. There's got to be a better way. That's why I'm doing this, because I do believe I have a better way. So that's the topic today, to show you how prevalent it is, to show you where we are going to go with this, and then to please share what I'm doing here with a few others. I'm just getting started. I don't have a big following. That's okay. I think I will someday. So share this with your colleagues and your friends who are in the profession and who want to get over this pain. So there'll be a few more videos, but really look for me this weekend when I'm putting the whole program together. And I think you are really going to like. Again, my name is Steve Zilke. Check out the whole program, dentistpainrelief.com. But regardless, just watch for these, and then I'll see you on the next video. All right, thank you.